so before entering my patient's room, I'll make sure I double check that this is the right patient and the right procedure. And it is, so I'll go ahead and knock, close the curtain, and perform hand hygiene. Hi, my name's Bree. I'm going to be your student nurse today. Could you go ahead and tell me your name and date of birth? Okay, and then I'm just going to double check and make sure that matches. And it does. And then the bed is already in high Fowler's position, and then I have the side rail down, and then it's at a workable height, so we can go ahead and get this procedure done easily. So are you in, or do you have any allergies today that I should know about? No? Okay. And then are you in any pain? No? All right. So today I'm going to be inserting an NG tube. It'll start in your nose and end in your stomach so that we can go ahead and get you the nutrients that you need since you can't take food in orally. All right. So to get started, I'm going to go ahead and put some gloves on. And then this is just going to be a little bit uncomfortable, but we'll work through it to hopefully make it not as painful. All right, so I'm going to go ahead and start by placing this bib on you, just so we don't get anything on you on your gown. And then I'm going to go ahead and measure from the nose to the ear, and then to the xiphoid process. And then it is already taped here, but if it wasn't, we would go ahead and mark it with a marker. Alright, so I'm going to go ahead and put this in some lubricant, make it easier to go in. Alright, and then I'm going to go ahead and tilt your head back here. Hopefully we can go get this in. Alright, and then once we hit the nasopharynx, we can go ahead and tilt the head down, and then Caroline here is going to give him some water. Get this back in there. Okay, so then once we're at our stopping point here, we'll go ahead and hold that. Get some tape here. Tape this here. And I'm going to wrap it around. And then to confirm the placement of this tubing, we would go ahead and get an x-ray and just make sure that it's in the right spot. Okay. I'm going to go ahead and also get some of the stomach contents so we can see if it's acidic or not. But we still will need the x-ray to confirm that it is 100% in the right spot. I'm going to attach this. I'll pull back here. Okay. And then I'll go ahead and put this into here. And then I would also just assess it for color, consistency, and make sure it's looking normal. Alright, and then I'm going to go ahead and take my pH paper here. Alright, and then I'm going to dip this in here for about 30 seconds. And then it's acidic, so we know it's in the stomach. Okay, and then I'm going to go ahead and tape this up here to make it more comfortable. And then also while I was inserting this, I would have made sure that if there was any excessive coughing or gagging, that I would use a tongue depressor and a light to make sure that it's not coiled. All right, how's that feel? Good? Okay. All right, I'm gonna go ahead and remove this here and clean up a little bit. All right, and then normally that would stick. But also the order or provider's orders call for suctioning, intermittent suctioning, but this isn't the right tubing, but normally I would take this off and suction. All right. How are you feeling, Bob? You feeling good? Okay. I'm going to go ahead and move the side rail back up. And then make sure the bed is lowered. Alright, and then I'm just going to put your call light here. Let me know if you have any questions or if you need anything, okay? Take my gloves off and perform hand hygiene.